And if you don't heal 100% or, which is possible, I guess it's just taking longer to do that, or if vaginismus reoccurs, I could imagine, based on my experience, is that one thing that happens is the trigger points again, those knots in the pelvic floor. Sometimes I have those come back and I know like, okay, like not to worry, we're going to do some trigger point release and then I'll be back to normal.
Exactly.
That's really my experience what happens, but is there anything else that women might experience to signify that vaginismus is back that they could quickly deal with?
Sometimes there's some hormone changes
Mm-hmm.
that are at play. Maybe they're experiencing some vaginal dryness, especially after having a child or in their nursing or breastfeeding, or they're approaching menopause or going through menopause. Those hormone changes can result in changes to the vaginal tissue, and that can, that little friction moment can re-spark some of those symptoms. But there are some really nice, easy ways to appease that too.
Okay, good to know. And let's talk about, you just mentioned menopause. Someone had a question about the vaginal scar tissue that they have. Any recommendation about dealing with vaginal scar tissue and surgically induced menopause skin? I have to be honest, I don't even know what that is.
Yes. So anytime we have instrumentation in our bodies, it can result in scar tissue. And so for management of that scar tissue, that belongs in the hands of a pelvic PT who's going to gently manage and safely manage that scar tissue. But there are gentle massage techniques that can be done to help soften that.
Okay. So massage is the way to go.
Yeah.
Cool. And tearing during sex, any advice on that?
Yeah. So with that, the tissue may be thin, and that can be a hormone-related thing as well. It's a highly vascular area, so it will heal. But with that, we want to be using the dilators to help gently stretch and make that vaginal tissue more elastic as a fixing the problem. In the short term, just keeping it protected, allowing it to really heal before trying again is going to be optimal. But a lot of times it happens with dryness. So using really liberal amounts of lubricant, 1 to 2 tablespoons. You can even load it up into one of those suspension droppers and inject the lubricant deep into the vagina just to make sure that there's not friction.
Mm-hmm. Yeah. Okay. Makes sense. I guess it's kind of like the analogy of like dry rubber and how dry rubber is more likely to tear than moisturized rubber.